Dr. Corey Maas on Looking Your Best. A lot of questions this week in rhinoplasty consultations about thick skin. First of all, what causes thick skin when we talk about nose surgery, and then what we can do about it. Thickening of the nasal tip skin in particular is common because there are many sebaceous or oil glands that are located in the nasal tip. Most people notice that there are larger pores. Some of these pores can have a little debris in them that's referred to as a blackhead, or in some cases a whitehead, if you will. It's not acne. This is actually debris in these larger pores. But because of the large glandular nature of the nasal skin, of the nasal tip skin. This is varying between different ethnicities, cultures, backgrounds, etc. And we have very big noses that have very thin skin, and I have very small noses that I take care of that have thick skin. The net is that there's not a lot you can do about thick skin in terms of your cultural background, but there are things you can do to make sure that the skin doesn't thicken any further. By keeping the pores clean, by doing good hygiene with cleansing, doing facials in some cases, and using the right kind of skincare, including a retinoid and L-ascorbic acid, vitamin C, in some cases topical medicine when the skin is thickening and you have a condition that's known as rhinophyma, a sort of extreme form of rosacea, which is red thickening of the skin that happens in the cheeks, the nasal tip area. In those patients, certainly medical treatment is necessary. But for most of us who have thick skin on the tips of our noses, it's really about glandular tissue, and in no way does this preclude you from having nasal surgery. And in fact, during surgery, there's some ways that we can actually thin the nasal tip skin from underneath. The dermis itself is thicker. There is a limit, obviously, to this, but in almost every patient that I see that has very thick nasal tip skin, there are some thinning procedures I do to help refine the tip and give it more contour. People who come in with very thick bulbous noses often have a combination of thick skin, very thick cartilages, and then soft tissue underlying between the skin and the cartilage itself. And all three of those areas are addressed to get the best overall results in contour for the nasal tip. So in summary, the thickness of nasal tip skin is really genetic and predetermined. It's not something that you can per se do anything about except doing good cleansing and skin care. And if you're really a candidate for rhinoplasty, there are definitely ways to help to refine and reduce some of that skin thickness during the rhinoplasty procedure. If you have any other questions about rhinoplasty surgery or nasal tip thickness, please don't hesitate to write me at drmaas.com. Send pictures if you wish, and I'm very happy to answer those and even do a consultation with you. This is Dr. Corey Maas on Looking Your Best.